Hey everyone, welcome to another video from Nutrition Market. In today's video, we'll be diving into the science behind natural supplements for weight loss. We'll explore common ingredients found in these supplements, their potential benefits, and important safety considerations. By the end of this video, you'll have a better understanding of what the research says about these supplements and how to make informed decisions about their use. So, let's get started. Overweight and obesity are major health concerns, affecting more than 2/3 of adults and almost 1/3 of children and adolescents in the United States. According to a study by Ogden and colleagues published in JAMA in 2014, many people are actively trying to lose weight, with 45% of overweight and 67% of obese Americans seeking solutions. While health experts agree that lifestyle changes, including a healthy diet, reduced calorie intake, and physical activity, are the foundation for long-term weight loss, as outlined in the 2015-2020 Dietary Guidelines for Americans, many individuals turn to natural supplements as a convenient way to support their efforts. The popularity of weight loss supplements is evident, with Americans spending about $2.1 billion annually on these products in pill form, according to the Nutrition Business Journal's Supplement Business Report from 2016. However, the evidence supporting the efficacy and safety of these supplements is often inconclusive or unconvincing. Let's take a closer look at some of the most common ingredients found in weight loss supplements. Keep in mind that in almost all cases, additional research is needed to fully understand their safety and efficacy, as noted by Manor and Patton Lopez in their 2022 review. First up, we have African mango, derived from the seeds of the Ervingia gabonensis tree. A few small studies suggest it may help with modest weight loss, but more research is needed to confirm these findings, according to a 2020 review by Watanabe and colleagues. Next, we have beta-glucans, which are soluble fibers from oats and barley. Despite their potential to promote satiety and reduce calorie intake, a 2004 review by Pittler and Ernst found no significant effect on weight loss. Bitter orange, which contains synephrine alkaloids, has been studied for its potential to increase energy expenditure and promote fat loss. However, the evidence for its efficacy is contradictory and weak, as noted by Manor and Patton Lopez in 2022. It's important to be cautious with bitter orange, as it can cause cardiovascular side effects, especially when combined with caffeine. Speaking of caffeine, this stimulant has been shown to increase energy expenditure and fat oxidation, potentially leading to weight loss. However, the effects are generally small, and high doses can cause side effects like jitteriness, anxiety, and sleep disturbances, according to the 2020 review by Watanabe and colleagues. Calcium is another ingredient that has been studied for its potential role in weight management. While observational studies have found that higher calcium intakes are associated with lower body weight, clinical trials do not support a clear link between calcium supplementation and weight loss, as noted in the 2004 review by Pittler and Ernst. Capsaicin and other capsaicinoids, found in chili peppers, may help increase satiety and reduce energy intake. Some studies suggest small effects on body weight, but more human research is needed to confirm their efficacy, according to Watanabe and colleagues in 2020. Carnitine, an amino acid derivative involved in energy production and fat metabolism, has not been found to significantly affect weight loss in clinical trials, despite its theoretical potential, as reported by Pittler and Ernst in 2004. Chitosan, a type of fiber derived from the shells of crustaceans, had a small but significant short-term effect on body weight in a Cochrane review by Pittler and Ernst in 2004. However, most of the studies were of poor quality, and more research is needed to confirm its efficacy and long-term safety. Chromium, an essential mineral, has been studied for its potential effects on body weight and composition. The same Cochrane review found a small effect on weight loss, but the effect size is of debatable clinical relevance, and the quality of evidence is low. Coleus foscolii, an herb containing the compound forskolin, has very limited research on its effects on body composition. More studies are needed to determine its safety and efficacy for weight loss, as noted by Watanabe and colleagues in 2020. Conjugated linoleic acid, or CLA, is a type of fatty acid that may cause modest reductions in body weight and fat mass. However, the effects are generally small, and the clinical relevance is uncertain, according to the 2020 review by Watanabe and colleagues. Fucoxanthin, a carotenoid found in brown seaweed, has only been studied in one clinical trial that found a significant increase in weight loss when combined with pomegranate seed oil. More research is needed to determine its safety and efficacy as a standalone ingredient, as noted by Watanabe and colleagues. Garcinia cambogia, a tropical fruit containing hydroxycitric acid, has conflicting evidence for its weight loss efficacy. Some studies show small effects, while others find no significant benefits, according to the 2022 review by Menor and Patton Lopez. It's important to note that Garcinia cambogia has been linked to some cases of liver toxicity, and its long-term safety remains uncertain. Glucomannan, a soluble fiber from the konjac plant, has mixed evidence for its weight loss effects. Some meta-analyses suggest no significant benefit, while others find a small effect, as reported by Pittler and Ernst in 2004. Green coffee bean extract, containing caffeine and chlorogenic acid, has very limited evidence from poor quality studies, according to Menor and Patton Lopez in 2022. More research is needed to determine its safety and efficacy. Green tea and its extracts, which contain caffeine and catechins, may cause a small increase in weight loss when combined with caffeine. However, decaffeinated green tea does not appear to have a significant effect, as noted by Watanabe and colleagues in 2020. Guar gum, a soluble fiber from the seeds of the guar plant, was found to have no significant effect on weight loss compared to placebo in a meta-analysis by Pittler and Ernst in 2004. Hoodia, a cactus-like plant traditionally used to suppress appetite, has insufficient evidence to support its efficacy for weight loss, and more research is needed to determine its safety, according to Menor and Patton Lopez in 2022. Probiotics, which are live microorganisms that may confer health benefits, have been studied for their potential effects on body weight and composition. However, the results have been inconsistent and likely depend on the specific strain, dose, and duration of supplementation, as noted by Watanabe and colleagues in 2020. Pyruvate, a compound involved in energy metabolism, has limited evidence from small, poor-quality studies suggesting a small effect on weight loss. However, the clinical relevance is uncertain, and more research is needed to confirm its efficacy and safety, according to the 2004 review by Pittler and Ernst. Raspberry ketone, a compound found in raspberries, has no human studies testing it alone. The only available evidence comes from a small study of a multi-ingredient supplement containing raspberry ketone, which found an effect on weight loss. However, the study had design flaws that limit the interpretation of its results, as noted by Menor and Patton Lopez in 2022. White kidney bean extract has been studied for its potential effects on carbohydrate absorption and weight loss. However, the evidence for its efficacy is limited and mixed, with some studies showing benefits and others finding no significant effects, according to the 2020 review by Watanabe and colleagues. Lastly, we have yohimbe, an evergreen tree native to Central and Western Africa. Its bark contains the compound yohimbine, which has been studied for its potential effects on fat metabolism and weight loss. However, there is insufficient evidence to support its use, and it has been linked to serious side effects, such as high blood pressure, anxiety, and heart palpitations, as noted by Menor and Patton Lopez in 2022. It's crucial to keep in mind that weight loss supplements can cause side effects and may interact with prescription and over-the-counter medications. Always consult with your healthcare provider before using any weight loss supplement to understand the potential risks and benefits. Some weight loss supplements have been found to contain hidden drug ingredients, such as sibutramine, a weight loss medication that was withdrawn from the US market in 2010 due to safety concerns. These adulterated supplements can cause serious adverse effects and may interact with other medications, so it's important to be cautious when purchasing and using weight loss supplements. In conclusion, the evidence supporting the use of natural supplements for weight loss is often inconclusive and unconvincing. While some ingredients may lead to modest weight loss, the effects are generally small and of uncertain clinical relevance. Many of the studied ingredients have limited or poor quality evidence backing their efficacy, and more research is needed to fully understand their potential benefits and risks. It's essential to approach weight loss holistically, focusing on sustainable lifestyle changes that include a balanced diet, reduced calorie intake, and regular physical activity. These foundational elements should form the basis of any weight loss plan, and natural supplements should be viewed as potential complementary tools rather than standalone solutions. Before considering the use of any weight loss supplement, always consult with your healthcare provider to discuss the potential benefits, risks, and interactions with existing medications or health conditions. Be aware of the potential for adulteration in weight loss supplements and purchase products from reputable sources to minimize the risk of exposure to hidden drug ingredients. Ultimately, the most effective and safe approach to weight loss is to adopt a healthy lifestyle under the guidance of a qualified healthcare professional, using natural supplements judiciously and with realistic expectations. That's all for today's video on natural supplements for weight loss. We hope you found this information helpful and informative. If you're looking for high-quality supplements to support your weight loss journey, be sure to visit nutritionmarket.com.au. We offer a wide range of products and have a virtual clinic with clinical nutritionists and naturopaths, serving clients in Australia and around the world. Book a consultation today to get personalized advice and guidance. Remember, while the content in this video is informed by research, it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, so always consult with a professional for personalized recommendations. If you enjoyed this video, please hit the like button and subscribe to our channel for more content on health, nutrition, and wellness. Thanks for watching, and we'll see you in the next video. Disclaimer: the information provided in this video is for educational purposes only and should not be considered as a substitute for medical advice, diagnosis, or treatment. Always seek the guidance of your doctor or other qualified health professional with any questions you may have regarding your health or a medical condition. Never disregard the advice of a medical professional or delay in seeking it because of something you have heard in this video.